My name is ARASE from the Fukuoka city. Fukuoka is a city, not a prefecture, like my previous speaker. And I would like to speak about our initiatives and the practical aspects of the urban planning at Fukuoka city. I am very grateful for this opportunity. So, unlike the Kanagawa Prefecture, Fukuoka City is a basic municipality. We provide services directly to its citizens, but also have the same authority as the prefecture in terms of financial resources. Such cities are called ordinance designated cities in Japan, and there are 20 of such designated cities. These are cities with a population of 1 million or more. And Fukuoka City, with a population of 1.61 million, is the fifth largest city among the 20th cities in Japan. Fukuoka City is the closest city to the Asian continent, and it is considered a compact city with an international airport, port, and train station within 2.5 kilometers. This is the scenery. The town has spread toward the Hakata Bay since ancient times. In the center is the Ohori Park, which used to be the moat of the Fukuoka Castle. It is a place of relaxation for citizens. It is indeed a compact city with a lot of greenery in the streets. This slide shows the average life expectancy of Japan. Both men and women are increasing. And this shows the aging population of Asia. Japan has the highest and fastest growing aging population. However, other Asian countries are also catching up, and it is expected that Korea will soon overtake Japan. In any case, the era of the 100-year life is almost here. It's just around the corner for many countries in the world. This shows the demographics of Fukuoka City. Although the population is said to be about 10 years younger than the Japanese average, it is certainly aging. The Fukuoka City shows aging amongst its demographics as well. So, we have created the Vision for Health and Welfare of the Elderly in 2014. With the imminent arrival of ultra-low birth rate and aging society, we have set the ideal vision for Fukuoka City. And 2 years later, in 2016, we formulated the Fukuoka City Health and Welfare Comprehensive Plan, which is a high-level plan for health and welfare in Fukuoka City with 3 goals. The first is a society where people are active and productive throughout their lifetime. The second is a society that draws on the power of the community and private sector. And the third is to be a model for Asia. We have also written into this plan our vision for 2040. So why 2040 is that in 2040, we will have the largest number of latter age elderly above the age of 75 years old. So we cannot realize an ideal city in 2040 without changing our mindset, our system, and our city itself. For this end, we have to achieve a good balance of supply and demand for 1.5 orientation. For society where people can age in their own way, to age in place. We would like to pioneer initiatives and disseminate the results to the world. What is 1.5 orientation? It means that we would like to balance the demand and supply throughout 2040. This is a slide that we have prepared to further the understanding of our citizens. People who require support are not determined uniformly by age, and people should be supported and become supporters depending on their needs so that we can balance demand and supply. The policy of lifelong active, productive working society is a part of this initiative as well. And Fukuoka City is very proud of its information platform. This platform centralizes the various data of Fukuoka City. Birth data, health check data, nursing care data. All of this data is centralized. And the results are analyzed and future estimates are drawn based on this data. It has been 8 years since we have started to employ this, and Kyushu University has conducted an analysis on this, on the epidemiological studies. The Hisayama epidemiological study is conducting a study into the future of Fukuoka City. By 2040, many of those in the latter stage of life, above 75 years old, will be living alone, which means that for those elderly citizens, housing will become more important. This shows the healthy life expectancy. There's a very big gap between the life expectancy and healthy life expectancy for both men and women, for Japan as a whole and for Fukuoka City as well. And this shows the data from the long-term care insurance started in 2000. And this is the percentage of Fukuoka City residents certified as needing long-term care by age group. It means that we have to start early in order to tackle this problem. And these are the reasons why Fukuoka citizens came to be in need of nursing care or long-term care. The cause is mostly from the lifestyle-related disease as well as the locomotive problems. So the word mibyo was raised by the governor, and we are also tackling mibyo in order to maintain a healthy life. Based on various data, we are making challenges toward the future of our city. And in June 2017, we launched the Fukuoka 100 project. Even though the target is 2040, first we are targeting 2025, and we would like to promote these 100 initiatives by 2025. There are 7 pillars behind these 100 actions. Number 1, a city where all citizens participate in care. Number 2, a city that transcends the boundaries of institutions and services. 3, cities where medical services in the digital society are realized. Number 4, a city where everyone can enjoy and be healthy. Number 5, a city where multiple generations are connected and active. Number 6, cities that are hubs for care-tech ventures. And number 7, cities that are internationalizing social care. Based on these 7 pillars, we have been promoting these 100 actions. However, this number 7 is facing some challenges due to COVID-19. As written here, this project is to create a society where both city and citizens are happy, not just individuals, but the society as whole. And I mentioned the 1.5 orientation earlier. We would like to create a well-balanced society for both city and citizens. And this is from 2017 when we launched the project. The Mayor Takashima, a bit younger than today, is at the center. And this is industrial, academic, public, and private sector initiative. So local hospitals, local enterprises, various stakeholders have been involved. So Fukuoka City has its strength, and we would like to leverage this strength in urban planning. And there are 3 main strengths of our city. First is that we are a young city, meaning that we have a lot of young people, and it's full of potential. Second is that we are a startup city, meaning that it's very vibrant, and we are able to attract many startups. And number 3, we have an active community. Community is one of the key important functions for the elderly as well. So we like to leverage these 3 strengths. And as we promote this project, we need to first change the behavior of each individual and provide the hardware and software infrastructure to support these individual efforts. So from here, I would like to introduce some of these initiatives in no particular order. First, active community activities. There are 142 local communities in the city, one for each elementary school district. And various activities have been conducted. This shows one example. So different communities have different characteristics, and one example is shown here. to provide a place of belonging and events working with the local enterprises. So this is an example. The residents had difficulty going to the supermarket because of the accessibility issues. So a bus service to the supermarket is being provided in partnership with the company. And this is the initiative to promote lifelong working society. So Public Employment Security Office called Hello Work is provided exclusively for the elderly. And we also provide online service. So matching people who want to hire and people who want to work. This is the main function of this initiative. And this is called a bench project to promote all residents to enjoy going out. It's been 5 years since this project was launched, and 174 benches have been installed thus far, and it's very popular. So this year, we are going to be further installing 350 new benches. And so this is going to really increase the number of benches throughout our city. So for example, universal benches are installed near the bus station, again like this. Also, this is another bus station, but we are also setting up benches to enable the elderly to move around and walk around more. And now I would like to talk about the increase of dementia. The incidence of dementia increases for those aged 75 and older, and the challenge of dementia is great in this super aged society. It is expected that the 25% of the Fukuoka citizens will be facing a dementia. So that is why Fukuoka has announced that we are going to be a dementia-friendly society or dementia-friendly city. And one of the project toward this goal was to introduce humanitude care. We are going to expand humanitude education throughout the city to all elementary schools, junior high schools, emergency workers, as well as other citizens. So this shows the training session. So in terms of the emergency workers or first responders, Mr. Ginesto himself gave a very careful lecture. And dementia cafes are held in the community as well. And another important thing is that we have developed a guideline for dementia-friendly designs. This is the ward office just opened in May. And so there's a bench on the first floor, and there's an escalator, and the rails are red, which is easier for the dementia patients to recognize. And we also have a diaper changing area, which is very visible. And this is the women's restroom with universal design. And this is the underground shopping center of Fukuoka City. And the women's restroom, again, is employing universal design. And this is the city's toilet. You can go with a peace of mind. And we also have online diagnosis, at-home medical diagnosis. So this was accelerated with COVID-19. And we are now expanding various online services for the elderly. And for that, we are also training the elderly to utilize these online services. We also have online visits, and we are trying to engage the elderly through DX, digital transformation. And we hope to create a society where everyone can enjoy happiness throughout their lifetime. And this shows the word office. Thank you very much. I will see you in Fukuoka once again. Thank you very much.